Good morning, everyone. This is our sixth Zoom meeting already. It seems like it started yesterday, but this is our sixth one starting in April, I guess was our first. So I think that's six if my accounting is correct. I hope everyone is well. I hope your families are well. I want to wish you Lashana Tova, an easy fast tomorrow. After our speakers speak today, I'd like the members at least to stay around. We have just a few short business items. I don't know, someone else may have one that I didn't think of. Dave Schwartz, as usual, I want to thank you for getting our program together. I don't know what we would do without you. We wouldn't have any programs, I guess. I don't know. I'm not sure.
Thank you.
Hopefully you live to be 100 and definitely outlive my presidency. But let's hope it's 10 more years than that at least. Anyway, thank you for getting the program together. Thank you, speakers, for being with us this morning. We actually have three esteemed speakers this morning. We have Judy Spillane and Robin Kaplan from Aleph Home Care. And I'm going to shortly give you a little CV on Judy and Robin, and after that they'll take some questions, and then we have Rebecca Rosenau from Jewish Family Service, who the other night got a nice award at the JFCS Zoom volunteer meeting. So congratulations to you, Rebecca. Judy Spillane is with us. Judy is from Aleph Home Care as well as Robin Kaplan. Judy's been with Aleph since December of 2016. She spent almost 22 years in corporate America. She decided she wanted to have a position where she would be doing more meaningful work, where she would be helping to make a difference in people's lives. Some of Judy's responsibilities at Aleph include overseeing the everyday operations, and she oversees the scheduling office. Additionally, she's responsible for marketing. She takes every opportunity to talk about Aleph and home care in groups, at doctor's offices, in facilities, or to an individual where she can. She's passionate about Aleph Home Care and working on a daily basis to enrich people's lives. I know we've all heard of Aleph. We're probably not sure exactly what they provide, but I'm sure she's going to let us know. So Judy, you're on. I think she's going to share some screens with us, so you'll probably see some presentations, but Judy, go ahead.
And Robin Kaplan, also the director of Aleph, is going to do the presentation with me. So
I can take a minute.
Yeah,
I was going to say I can take a minute. I have Robin's CV here. I'll take a minute.
That would be great.
She's the director at Aleph Home Care and the Aleph Daycare Center, or the Aleph Day Center, I guess it is, at the Federation. She's been working in the healthcare industry also for over 20 years. She oversees the business growth and development of Aleph while assessing community needs and building community relations. She's made it her goal and ambition to ensure that seniors in the community receive the highest level of home care. Robin has spent the past 8 years growing Aleph Home Care and identifying additional opportunities to enhance the lives of the seniors. In January, Robin, along with the Aleph team and the Jewish Federation, opened the doors to the Aleph Adult Day Center. Robin continues to be an advocate for older adults by ensuring that they receive the resources and care necessary to live life to the fullest. Robin has always had a special place in her heart for the seniors. So go ahead, Judy.
Well, thank you so much for having us this morning. As Ed said, my name is Judy Spillane, and I do operations and marketing for Aleph Home Care. One of the things that makes it really for me, besides just being able to help people, I'm born and raised in Chicago. I still live in the area. So, I'm getting to help people that that maybe I've known my whole life. So that, it's a bit more personal for me. But yeah, thank you for letting us come, because we love the opportunity to be able to tell you how we can how we can help you or someone, someone in need with Aleph services. I'm going to let Robin introduce herself as well.
I am Robin Kaplan, as you heard about me. And Aleph has been my passion for the past 8 years. We really pride ourselves on great service that we offer the older adult community. And being that we're part of the Jewish Federation, we're very fortunate because we have the sustainability and the backing from an organization of which people trust and rely on. Aleph gives us an opportunity to go into the homes of people, and home can be a rehab, it can be a facility, it can be on a trip. We've definitely gone on trips with people to help them get to their destination where they want to go. They still want to travel. So we have definitely been able to help them in doing that. But we really pride ourselves on not saying no. We pretty much always say yes, because we want people to feel independent as long as they can. And home care doesn't have to be when you're so sick. It can just be that you can't drive as much, or you have to give up some part of your independence that you feel. And it gives us the opportunity to help people and enable their independence and feel like they can still do everything they did before, but just maybe have a little bit more assistance. And I'll turn it over to Judy.
Okay, so this I'm going to tell you is the first time that we've ever used this PowerPoint. So if we seem a little clumsy with it, excuse us. So anyway, Aleph Home Care does personal care and companion care from 1 hour to 24/7 round-the-clock care and live-in care. So we can help with personal care, help with activities of daily living, bathing, dressing, grooming. We can help if somebody's just feeling a little bit lonely or feels like they're nervous to be alone, even if they can still do things for themselves. We do that an awful lot. We help with transportation to and from doctor's offices. If somebody has, a colonoscopy and endoscopy, if you need us to pick you up, take you there, wait with you, bring you home, we do that for lots of people. We can also help with just running errands, taking you to the market, taking you to, to see a friend, or, to go clothes shopping, whatever it is you need to do. Some of the things we've done.
Judy, could you go into slideshow mode? If you just go to the top, slideshow, that way it's the full screen.
Oh, wait, at the top.
We're seeing your preview slides as well. Up, straight
I don't know where that is.
Straight up in the middle, slideshow.
Oh, right here.
Yeah. And then you can start your slideshow from the beginning.
Oh, here.
Yep.
Okay. Now you.
And now we only see that slide.
How do I get to move it to the next one then?
You can just click forward.
Oh, I don't see forward anymore.
On your computer, an arrow key.
Ah, thank you.
You're very welcome.
Thanks, Phil.
Okay.
Yeah,
Thank you.
it's much easier to see.
I told you I was going to be a little clumsy with this, but that's awesome. So, anyway, some of the special things we've done is we've taken people to family affairs, to bar and bat mitzvahs, to weddings. We can go when somebody comes, even if they're out of town, we've gone and stayed in the hotel with them, help them get ready for the affair, sit with them, get them food. So, the other family members don't have to, can continue to see their guests and enjoy their party. And all, the people who need a little extra help don't have to miss it. So we feel that that's really important. We've had a certified home health aide go on a cruise with one of our clients. She's actually gone 2 years in a row. So that, that's, home care is just so much more than being, in your home and taking care of you. Robin, you want to add to that?
So I'll just give a personal story. I've used our home care services for my daughter's bar mitzvah, for my grandmother. she would not have really been able to come unless we had a home health aide that could bring her, could accompany her and help her get dressed and go. It was the greatest thing. The gift was, it was a great, I can't even express it. It saved us, because we wouldn't have a bat mitzvah without her. So for her to be able to get up on the dance floor and be held a little bit and helped, and at this point she was 96 years old. So we were very fortunate, and we used the service, and it was wonderful. And most families after a bar bat mitzvah, when they're able to have a loved one come that they never thought would be able to attend, it's beyond amazing. The feeling that they get, it completes the family, and it feels like you're missing somebody when you can't have that one person there. And we take all the responsibility, the getting the dress, getting them there. If they get tired when they're at the affair, we leave early. We help feed them. We make sure they're taken care of. There's no worry on the end of the family. And I think it's a priceless feeling inside when you know that you're caring for people that at an affair, that there's nothing more that a grandparent or aunt, great aunts, uncles, whomever would love to do is see their grandson, granddaughter bar mitzvah, wedding, anything. So that these are like, those type of stories are the ones that really touch my heart, because they're a special moment in somebody's life that they will never forget.
So we want to talk about some of the reasons that you may need home care. Some of the signs that your loved one or a friend, and it may be time to call us and talk about it. If you've seen somebody have a drastic change in weight, their appearance when they used to be really, neat and clean, they start to look unkempt, a messy kitchen, a lot of expired food. We all start to forget things, but, abnormal forgetfulness, unexplained bruises, starting to fall, difficulty sitting and, standing. When people start to miss appointments, miss medications, unpaid bills, scratches or dents in cars would certainly be a reason maybe they would stop driving. But it's always better to call us sooner than later, know what's available. We're always willing to answer questions, even if it seems like years away that you may need help. We are, Robin and I will always be happy to talk to you about any concerns or how we can help.
And it's definitely better to get a head start on that before it's too late, in a sense. And too late, is the day of, where somebody's in the hospital and the sheer panic comes over, and you feel it's too late to really research your options and what the home care can be. So these are just signs. And again, they're just indications that something might not be right. But that doesn't necessarily mean that the minute that you see somebody have expired food in their apartment or house that they need home care. It's just starting to, this list of items starts adding up. And then it's, oh wow, we need somebody. The car situation is probably one of the most drastic changes in somebody's life, which is when somebody is told they can't drive anymore. And we find that is a huge, that is a huge reason why people end up getting home care. And just to quickly go back for 1 second to personal care versus companion care, we offer both. A home health aide through the New Jersey's, they have a certification, so they're a certified home health aide, and they provide all the services of actual touching, meaning grooming, bathing, dressing, whereas a companion does light housekeeping, meal prep, and driving. The home health aides can do anything, both what the companion does and the home health aide, but a companion cannot do the bathing, dressing, grooming, and the actual physical touching. So some of these things you may just hire an agency like us just for companion care, just to have somebody kind of have oversight over those messy kitchens or the expired food. But in reality, time will tell if they'll need a home health aide. And sometimes it's good to get somebody in just to transition, so that when there is personal care needed, they'll have already been used to having somebody in their home.
So, you know, some of the reasons that people hire us, besides, you know, my mom, my wife, my partner has fallen, is starting not to be able to shower themselves, has a lot of forgetfulness. I mean, we can just help you be safe, feel secure, have peace of mind if if you need to go to work and you can't leave someone home alone. But really, our passion is really to help you age in place, wherever that place is. So we said earlier, it doesn't need to be in your home. It can be, if somebody's in rehab, oftentimes we find rehab and hospitals, oftentimes we hear that patients aren't getting the kind of attention that they need. They ring the call bell and they can wait and wait. So we are often called to go into rehab facilities and hospitals. So, you know, I don't think people think about home care for that, but that certainly is an option. We work in lots of senior communities. And, you know, so just, we think out of the box. So when you call us, we almost won't say no. I can personally bet Robin will never say no. I may think about saying no, but she will never say no. There is always a way to do something.
And just to make note, the picture you're seeing on the screen right now with the two women, that was a client of ours with her home health aide. And this particular home health aide worked with this woman and her husband. Her husband passed away. This woman was a live-in. And I love this picture because it's true. It's not a stock photo. It's an honest, you know, it's honest. This is who we are. This is a relationship built where this woman became, this home health aide became this woman's world. And you could see it by the look. And that was just a captured moment. It was not, you know, it's just, I feel like when people can see what happens, home care is not a bad thing. Home care can actually enhance people's lives. And in this woman's case, it certainly did.
So this, you know, Robin went into this a little bit about companion care, that it's a non-medical form of home care, that, you know, if somebody just is a little bored at home. We have men who have home health aides come in and, you know, just to pretty much play cards with them and hang out. You know, so their wives can leave, or vice versa, leave without worrying. You know, when we get into personal care, we start to attend to physical needs of someone. It's a higher level of care if they need help showering or dressing. Transitional care, and I don't want to go into, you know, reading this whole thing, but we have full-time registered nurses. 2 of them on staff. So home care starts with a complete assessment to figure out the plan of care and relay that to the home health aide, and so that everybody has the same expectations when we come into the home. Exactly what's to be done. But our nurses do more than that if necessary. So they can go to doctor's appointments with clients if needed. They do med box fills. They can do bandage changes. So that, you know, that's not traditional home care, but it is something that we are starting to do more often. Robin, you want to talk about transitional care also?
Sure. Transitional care is something that I've always been passionate about, because when I was, prior to being at Aleph, I worked at the University of Pennsylvania Health System for many years. And one of the programs that I worked on was a transitional care program. And it was a pilot program through an insurance company with Penn Medicine. And what we realized is that people are discharged from the hospital and they end up back in the hospital within 30 days, very often, more than not. And the reason being is medication management, not having oversight when they get home. Discharges from the hospital are very quick. People do not retain the information they're given at discharge. Their families struggle to retain the information because you're so nervous about getting the person home safely. You've been upset if they've been sickly. So the goal with transitional care nursing is that we have are registered nurses that can do med box fills. They can come out and check vitals. If there's bandage changes, they'll do that. They'll look at a wound and say, this is what needs to be done. So they're an extra layer of support and assistance so that we prevent anybody from going to the hospital. Now more than ever, we want to avoid our clients and everybody going to the hospital and going back to a hospital because of COVID especially. And being that families are unable to visit their loved ones, the goal is for us to keep people home. So what happens when a nurse finds out, or goes and visits and sees the blood pressure is off or something isn't right, they will immediately follow up and call the doctor. So our nurses take it to the next level. They take that part of the puzzle out from the family so they can handle it. And the family doesn't have to deal with contacting the doctor and figuring out what to do. So it just takes that extra, we add an extra layer to our care. This is a special, an addition to home care, but it is something that has definitely prevented our clients from ending up back in the hospital. And prevention is really the key in keeping people out of the hospital.
Okay, so in the state of New Jersey, there are approximately 1,800 home care companies, which is mind-boggling to me. But so you really want to know who you're doing business with, and what they're doing to vet their aides and make sure that the person coming to your home is someone that they know and somebody that they've checked out. There's also registries in the state of New Jersey. So a registry does not hire their employees. They are 1099 employees. And that's something that you really want to be careful with. You want to make sure that a real sign of a registry would be if you were paying the company and then paying the aide. So you'd be paying them separately. That would be a telltale sign that you were doing business with a registry. But all of our caregivers are employees of Aleph Home Care. We have vetted them all. They are all background checked. They are bonded. They are insured through the Federation. We are legally responsible, for sending them. We pay all of their taxes, workman's comp insurance, liability. So that, we wouldn't send anyone to your house that we wouldn't send to our own family. So we really, as we hire people, we try to think about whether we would use them for ourselves. But that doesn't necessarily mean that somebody that my mother likes or I like, you're gonna like. So I always say that it's our responsibility to send you people, but it's your responsibility to tell us when you don't like them. Because we do employ about 80 home health aides, and there's always room to make a change so that you're happy with what with who we're sending you. Robin, you want to go?
I just always caution people when looking at a home care agency. If somebody says, I want a specific, agency, but they don't really know the difference, and it happens to be a registry. The goal is just make sure that no matter what home care agency one chooses, that they're bonded, insured, that they employ their home health aides, because registries typically don't employ their home health aides, which means you're paying the home health aide and you're paying the registry that gives the person your contact. The reason being is if God forbid something happens where the aide gets injured, the client gets injured, they're not, the registry will not be liable. So therefore the family has to deal with the home health aide, and it would be very challenging to sue a home health aide. In our case, we cover the workers' comp, we cover everything. And it's just, it's a safety. If God forbid there's anything wrong, we take care of it. We handle all of the issues. When you are hiring a registry, it's on you, and you could become very liable. You also want to make sure that they're taking taxes out of paychecks, because, that becomes a problem too. And then the home health aides end up getting into a lot of trouble because they can't afford to pay the taxes at the end of the year, and the organization can get into trouble. So as I said at the very beginning of all this, we're lucky that we're part of the Jewish Federation. All of our aides are paid just like we are. They receive the same benefit offerings just like Judy and I do. So we pride ourselves on that. we feel like treating our staff, with the highest level of customer service, just like we would with our clients, is what makes it work. And they're great human beings, and we like to say we're different because of our customer service and our true passion. And we really treat everybody like they're part of our family, whether it's an employee or a client, and the family as well.
And another thing that you really want to make sure, whether you use Aleph or you don't use Aleph, is that there's a registered nurse who is overseeing all of the care that a certified home health aide is providing. So one of the things that happens is with home care is you see a nurse when you start home care. Every 30 days, that nurse checks in to make sure the plan of care is still appropriate. And every 60 days, the nurse will physically see the client again. So even if you weren't using transitional care, you still get this whole, this whole nursing plan in addition to just home care.
And any New Jersey home care agency must be accredited through the state of New Jersey. So you would want to make sure that you ask that question. Are you accredited through the state of New Jersey? If they're not accredited through the state of New Jersey, the state will shut them down. So it's not worth even starting with them. They will be shut down.
So in this crazy world we live in right now, everybody asks, how are we protecting our clients and our aides from COVID? So the real answer to this is we're doing the best we can. But we have consulted with infectious disease doctor who works on the front lines in a hospital in New York, as in the beginning of COVID, and we still can have access to ask him any questions we need to. All of our home health aides are provided all the personal protective equipment that the CDC recommends that they have. So they are all wearing masks at all times. They have gloves, hand sanitizer, but more importantly, everyone's trained in hand washing. And I know that sounds crazy, but they've all been trained to make sure that they are doing everything as appropriately as possible. So that that's something that we really want to stress. All of our caregivers are also trained by Aleph, ongoing training. Every one of them has training in dementia care and Alzheimer's. We find so many of our clients need that. So it's important that we continue to educate the caregivers as needed. You want to add, Robin? You're good with that?
I think you're good.
Okay. So we here, this is our phone number. We would love for you to contact us with any questions at all, even if you aren't ready for home care. I urge you, if you have any concerns or questions, to call us, and I promise you, you will get a call back in a very timely fashion. We're all working kind of remotely right now, but we pride ourselves on customer service. If you call us, you'll never get an answering machine. Even if it's 12 in the afternoon, you won't get one, or 12 midnight. So don't hesitate to reach out to us. And we'd love to answer any questions you may have. And thank you so much for letting us come.
Thank you.
So we're going to take some questions, Judy, if members have questions.
Absolutely.
Let me see if I can, there we go. Okay. Let me see if we can.
Here, I can unmute.
Okay. All right, if anybody has any questions, Phil?
Yeah.
Sure.
Go ahead, Phil.
This is not a question. This is, Judy mentioned there may be 1,800 agencies. I am going to take away all of your consumer shopping. Aleph is absolutely, without a doubt and without compare, the most incredible resource that we have available. My grandmother lived independently until she was 99. She fell and broke her hip. And after that, could not live independently any longer. She made it very clear she wanted to stay in her home. And it was a 100% Olive that allowed her to, as my wife says, we were able to give her the end of life experience that she wanted with more love and care than you could possibly imagine. My wife worked with Robin all of the time, and to coordinate the care, the aides, the nurses. When I tell you, Robin, okay, when we worked with Michelle would make soup and bring it into my grandmother just to make sure that she had homemade chicken soup to eat, because she knew that she would enjoy that. Yeah. It was such a comfort, not only to my grandmother, but to all of us, that she received incredible care. I cannot say enough good about Olive and all of the people and all of the love that they bring with them.
Thank you. Our team loved Grandma Rose.
Yeah.
Loved her.
Yeah.
Loved her.
Yeah. We could not have done it without you.
Thank you. Thank you so much.
Thanks, Phil. That was very nice. Len Berman?
Hello. Thank you for the presentation. Question, are any of the services covered by Medicare, or is this all privately funded?
It's private pay or long-term care insurance,
Okay.
but
now,
not Medicare.
Okay. With long-term care insurance, does the person who needs the care contact the insurance company, or they turn it over to Olive and Olive makes all the contacts? How does that work?
What we do is we have a woman that handles actually the long-term care and with the client or the family. So once we find out, when Judy or myself take a new intake and we find out that somebody has long-term care insurance, we have the individual in contact with a woman in our billing department. Her name's Lakia, and then she will speak to the individual and figure out what's the best way. Oftentimes we are the ones that contact the long-term care company, but they do have to allow us to be able to speak to them about on the person's behalf. Sometimes it has to be a three-way call, but we figure it out to make sure we facilitate it, because there are a lot of different ways that we have to do a timesheet, and the aides have to match the care plan with what they're doing. So, but we handle it with no problem. It's really a smooth process because we have somebody really focusing.
Thank you very much, because I figure at the time I'm going to need this, I'm not going to be able to deal with the long-term care insurance company.
Yes,
So thank you
no
very
problem. Sure.
Gary Sternberg?
Yes, I have a question, but first I wanted to make a comment. I want to praise the services you guys do. When my father was very, very sick with Alzheimer's, he's out of Florida, so it wasn't all. But one of the real benefits was when the home health care person came for 4 hours, my mother, who was caring for him, actually was able to have a life for 4 hours. She was able to go shopping on her own. She was able to be with friends, meet people for brunch, which she was not able to do. So when he was sick, it was not only a burden on him, it was a burden on her. So the service you provide is very important from that perspective. Now, my question is, what's the geographic area that you cover? Is it South Jersey only? I mean, how far do you go?
We do Burlington, Camden, and Gloucester counties. But again, if the individual wants to travel to visit somebody, we will, they can travel, or they can go into Philadelphia to take somebody to a show or to dinner, or whatever that might be. But our area is Burlington, Camden, Gloucester County. Most of our clients are within the Burlington and Camden County area.
And the only way that we could possibly go a little further than that, because I know we've gotten calls like for Atlantic County, would be to place a live-in there. And we have done that.
We can do live-ins, in a different county.
Does everybody, Dick Knopf, I'm going to recognize you, but if you'll wait just 1 second.
Sure.
Does everybody know how to raise their hand electronically on the screen so that I can see your hand rather than waving to me? I'm trying to remember myself. Len Berman, you did it. Tell everybody where they can raise their hand.
All right, down at the bottom, it says participants. So if you click on participants, a thing will come up, and at the bottom of it, it says raise hand. You see that? And you click on raise hand, and next to your name, the hand will go up.
Right.
You got that?
Thank you, Len. Go ahead, Dick.
Yeah, can you hear me?
Yes.
Okay. I just want to tell you a personal experience about 2.5 years ago, maybe 3. I broke my ankle and we really didn't know where to go. I think Aleph how long has Aleph been around, by the way?
Almost 8 years.
Oh, okay. So, whatever. We ended up calling Aleph. Now, this was Labor Day weekend. I got to tell you, if there is a tough time to get service from anybody, especially in the medical community or related fields, it's on a holiday weekend. And that was a tough one. But Aleph, and we did call other agencies, they couldn't service us. And then someone recommended Aleph, and a gentleman came down from the New York area, had to take the train. I mean, this was really difficult, but he was wonderful. We just needed him for a couple of nights, provided a great service, and I can't say enough personally. Fortunately, my ankle is better, hobbling around like the best of them now. So you definitely get an applause from me.
Thank you.
Thank you.
Sounds like you have a very appreciative audience.
We appreciate you all. Thank you.
Yeah.
Do I see anybody? Anybody with hands up that I'm missing? I'm scrolling through. Len Berman again?
No, that was just a sample.
That was a sample,
I'll
okay.
take me down.
Rob Sachs.
Did I understand that these Olive offices are all over the country, or are they limited just to the Cherry Hill area?
Aleph Home Care is just the Cherry Hill through the Jewish Federation of Southern New Jersey, and that's it. Unless other federations decide to start a home care division like Aleph, it is just strictly with us right now.
Thank you.
So I'm curious, I'll ask one question. Does Aleph compete with companies like Bayada and so forth, or are they more nursing, whereas you're more kind of home care and some nursing?
Aleph does compete with Bayada and other agencies, a little bit different in that Bayada does offer skilled nursing and has pediatrics and some other things that we don't offer. So are they a direct competitor? Yes, but they do offer a lot of other things. So I don't know if they push as much the private sector.
Home care.
But there's a lot of competition out there. You know, we try to just look what the market rate is, make sure we're in the right pricing bracket, make sure we are doing what we need to do. But again, it's really, I try not to look at the competition so much because I care more about what we're doing, make sure we do it right. I don't need to, you know, I want to make sure we're doing what we want to do as far as providing the best care.
I wonder if you could just give us an idea of price ranges per hour or something like that for the people that you're providing.
So a price is approximately $26 an hour for 4 hours or more of service. And, you know, Robin said we check prices. We often check prices. So we know that we are not the most expensive out there. We also know that we are not the least expensive out there. So we're right in the middle. We do less than 4 hours of care. So the less care you have, the price just goes up incrementally, but you know, approximately $26 an hour.
And you will do 24-hour-a-day care if needed?
We'll do 24-hour-a-day care if needed, and we can do that 2 ways. We can do that hourly, where we would put in maybe 2 12-hour shifts or 3 8-hour shifts, or we can do live-in care. And a live-in, you know, becomes part of your family, moves into your home, and is able to take care of you, you know, all day long. We just require that they get a 6 to 8 hour break, you know, so they can rest as well.
And do you provide long-term live-in care also?
Mm-hmm. Yes.
We've had live-ins that have been with clients for years.
For years, like 5, 6 years.
Yeah.
And are you similar? I'm going to ask you a business question. Are you similar to, let's say, a temp agency where you possibly rent to buy? Do I have to explain rent to buy or what I'm
No.
thinking, or no?
So that's one of the only things you can't do with us. You, if somebody one of the things you sign in our client agreement is that you won't hire our aides privately. I'm assuming that's kind of what you mean?
Yes.
Yes. So that's one of the only things you can't do with us, is we really don't want you to hire our aides away from us. Yeah.
Even long-term, in
Even
other
long
words,
term.
even long-term. So if
Mhm.
you've had somebody for a couple years, you've signed a waiver, or call it whatever you want, that there is no, that you cannot hire them away from you.
And also, honestly, the truth is once, if they were not working for us, they would no longer be covered as far as workers' comp. And
No, I realize that. Sure.
Ed, it's Philip. You wouldn't want to. The folks at Aleph are rock stars. If that person got sick or had to leave your family for a day or a week, they've got a replacement there. You don't have to think about it. You don't have to worry about it. They take care of everything.
Mm-hmm. Yeah. No, I was just wondering what the business model was when it came
Mm-hmm.
to, as opposed to an employment agency or something like that.
So
Anyway.
let me just comment a little bit more about that. So our client agreement, when you start with us, nothing's carved in stone. So you're not making, I just want you to know that even if you needed us for one day or, 1 week, you're not making any long-term commitments with us.
Okay, thank you. Anybody else? Hands up. Rabbi Aaron?
Yes, first, I would recommend Aleph Home Care, just from my experience, what they've been doing in the community since they started. It was a wonderful thing that our federation decided to do this, and their service has always been top of the line. So when people ask me personally, where would I recommend, Aleph Home Care is really right up on the top. The question that I have is really coming from my background as a chaplain, and that is the issue of spiritual care and spiritual support, which is recognized within the hospital industry, within the hospice industry, something that we see often mandated in long-term care facilities as well. Do you have ways of referring people to that type of support, which is often quite important in maintaining either for short-term or for long-term goals? Because you are in some ways separated from, if you had a spiritual home, you're separated from that because of the infirmity that you're dealing with, or you may not even have that as a resource to go to. Person may not have a church or a synagogue or a mosque.
Yes, so if we are providing home care for somebody and they can't leave their home, or they need assistance, we'll ask them. I mean, if they want to have a rabbi, a cantor, anybody come to say prayers with them, or even if they're not affiliated, we will try to reach out to somebody to make sure that they're given the prayers that they want. A lot of people can't attend services. In years past, I won't count this year, but Rosh Hashanah, Yom Kippur, they can't attend, they're too long. So we try very hard to find somebody, a chaplain, some sort of a Chazan rabbi, and definitely can certainly refer people to you, because it's very important. Most of the time we find it's at the end of life that people will request it, and at that point they typically have hospice also alongside with us, so the hospice starts that ball rolling. They say that they want to handle it, so we work a lot with Samaritan, so they will jump on board and they will be the ones typically handling it.
The Samaritan's very good for this. Is that part of your assessment, a spiritual assessment, or is that not seen as necessary?
We don't.
Okay.
We could consider adding it, but we haven't quite yet.
Okay.
Right,
So
I'd like to thank you both, and I think we've all got a much better idea now. We see this name Aleph, but if we haven't had occasion, like some of our members, obviously a number of our members have used them, and the recommendations keep flowing. So thank you very much for taking the time to talk to us this morning. If you'd like to hang in, if someone else has some questions, I'm going to ask Rebecca Rosenau if she'd like to speak now. Rebecca is the, if I remember, she is the Director of Senior Services at JFCS, which is one of our favorite charities and arms of the JCC Federation. So Rebecca, go ahead if you would. Rebecca's going to tell us a little bit about the agency and what their mantra is.
Thank you.
Absolutely.
Thank
Thanks,
you.
Judy. Thanks, Rob.
Happy New
Thank
Year.
you. So I'm going to provide a more simple overview for today's sake, since you just heard a lot of information, and it's of course difficult to digest too much at once, but I and JFCS will be here as a resource for you. Hopefully we already have been. I just want to say it actually is timely that I speak right after Aleph, because Aleph, as the home care agency of Jewish Federation, works very closely with us as the social service agency of Jewish Federation. As I often say, many of our clients need or already have home care, such as through Aleph, and many of the Aleph clients, oftentimes they need a social worker, they may not know it, and or they have partaken in some of our support groups. So it's really sort of that holistic, interdisciplinary approach that we work very closely together. Before I go into the JFCS services and a little bit of an overview, I want to thank all of you on the call, because it's been brought to my attention. I already was aware in many cases of the volunteer efforts, but of the recent COVID emergency fund, that your group was very generous, and we are most appreciative of your contributions that have helped our clients and community at large. In addition to the financial contributions, I know a number of you, including Ed and David, are most dedicated volunteers of our agency. I know Dick also, Rabbi Aaron, I know a number of you. So thank you truly for your time and your dedication to make our services viable and to really support the clients that we work with. When it comes to my speaking, I want to speak not only of our services, but also volunteer opportunities just a little bit. And unlike home care, our services have been impacted a little bit more than home care, let's say, with respect to COVID-19, in part because not everybody wants to or is able to be COVID tested regularly in order to partake in direct client services. So when it comes to volunteer opportunities, for instance, many of those opportunities have become what's known as either contactless or phone-based services only. For example, our friendly visitor services. Some of you on this call, or many of you have maybe heard of friendly visitors, whereby in the past, individuals would be matched with a client. Perhaps they were looking for somebody that was like a parent figure or more of a friend or a companion. Let's say both veterans or both worked in the legal field. So maybe you're looking for somebody with a similar background and you're just looking to be a volunteer for them. Well, at this point, those services continue, and certainly we're always looking for people to help our clients. However, it's really by phone or computer at this point, since we're trying our utmost efforts to keep everybody safe. That being said, some of the areas that have really expanded have been in the areas of food, since many of our clients previously may have had some challenges with food access. Now it's only increased, either out of fear or out of transportation gaps and not being able to get to the store. So we've created programs which rely heavily on volunteers, including a personal shopper program, whereby once a week or every other week, a volunteer may be willing to do some food shopping for clients. So I merely mention it just to let you know both that it exists if you know somebody in need, but also if you're looking for volunteer opportunities. Some people say, I go to the food store, it would be no problem for me to pick up somebody else's grocery list. It's no out-of-pocket cost to the volunteer because the client pays for their own food. They just can't get to and from the store. So I merely mention that. Also, we have a catered home delivered meal program through Betty the Caterer. And Ed, do I have the screen share ability at this point?
No, but I can make you a screen share.
Okay, I think it might be helpful. I don't know. I'm visual. I don't know about the rest of you. So maybe just to show a few things.
Hang on one second. Let me just find you real quick.
Okay. While Ed is doing that, also just to break down some barriers, JFCS, Jewish Family and Children Service, as the social service agency of Jewish Federation, we're here to service everybody, regardless of race, religion, ability to pay. We have services for individuals from the very beginning of life to the very end of life. And we work collaboratively and very closely with as many of the community agencies that we can in order to support somebody to age in place successfully at home, wherever that may be, to implement services short-term or long-term. And those services do not always come from us. It may be that somebody's looking for a service that JFCS doesn't provide, but we are able to find a service that can help them to really remain safe in their home. Or there are times that somebody wants or perhaps needs to find an alternative to living at home, and we can help them do that also with finding an appropriate living arrangement, or with finding subsidized housing, let's say, or subsidized services if they can no longer afford the private pay home care or several $1,000s a month housing or the like. So the only problem I'm going to have probably is showing you well, let's see.
We're seeing your screen. We're seeing a screen now.
I know I'm not showing a PowerPoint. I'm just showing some flyers. So I'm not sure if this is going to be. Are you able to see that clearly?
We're seeing a screen that says, "Are you 60 plus or caring for someone in this age group?"
Correct. So I'm just
Okay.
going to show a few visuals, and by visuals I mean the flyers, because the services of the senior department typically include for anybody over age 60. Now, again, JFCS is here for everybody of every age, but we will help determine as to which department or which service somebody can, and some of this information you can see is not most up to date, but it still gives an idea. We provide everything from intake. In other words, if somebody has a question or they're looking for a service for themselves, a family member, a friend, they can call us at the number I provided it in the chat at our main agency phone number to ask for anything and everything, and we will do our best to guide them to the right location. We also offer more individualized and comprehensive what's called resource consultations, where we can help somebody, let's say they have mom, dad, or a loved one living in Florida or in Pennsylvania or in California, and they want to move to South Jersey, and they don't know where to start with respect to housing, implementing in-home services, what insurance, legal, or financial considerations they might want to consider with making the most appropriate decisions, not only for the care that they need right now, but perhaps thinking ahead so that they're not looking at moving 2 or 3 times in the foreseeable future. So our services really comprehend an individualized plan of care. That being said, we also service, as I mentioned, some people just on a short-term or long-term basis in the food area. So I'm going to show you our catered home delivered meal flyer, which I mentioned, which several of you have been so kind and are active volunteers, whereby you deliver food to clients weekly, every other week, once a month, or on occasion. In addition to our food program, we also have a food pantry. So there are some individuals, short-term or long-term, going through financial changes where they can't afford their food. We never want anybody to go hungry. So the catered home delivered meal program does have a cost because it's provided through Betty the Caterer out of Philadelphia. However, we have 3 food pantries in the South Jersey region, and we are also able, free of charge, to deliver food from our food pantries to you or a loved one or a neighbor who's going through challenged times. This menu changes, I would say, generally 3 to 4 times a year based on feedback, where one could order meat and poultry items, fish, dairy, vegetarian. The menus are pretty comprehensive, and I'm sure it's fairly small on your screen. I am absolutely happy to send these to Ed and Dave so that they can either have them or share just some of our more basic flyers so that you have them in the time of need. Some people will get these meals, let's say after a surgery, just one time, short term. Other people get them absolutely every single week. There's no right or wrong. We are here to meet your needs, short-term or long-term, with respect to food. One of the things that we've seen a huge, let's say, uptick or increase is in the area of counseling. And also, many people don't realize that their mental health needs are oftentimes covered by their insurance. Just like we go to a doctor, whether it's a primary care physician, a podiatrist, a cardiologist, if your insurance covers your visits to those doctors, it probably covers in full or largely also for you to have an individualized licensed mental health professional to help you deal with what you might be experiencing. Oftentimes it's related to depression, anxiety, grief. Those are just some of the larger topics, but it could be a number of things. And really during COVID, we've had a huge increase in whereby individuals are seeking services. Again, it might be 2 or 3 sessions. It does not have to be long-term, or it may be long-term. And the benefit at this time is that we are doing all of our services by telehealth. So Medicare and secondary and commercial insurances are,
They're very good too.
thank you. They are allowing, the insurance companies are allowing telehealth, whereby each of us are sitting in the convenience of our own homes. There's certainly more flexibility if somebody's looking for an 8:30 or 9 a.m. appointment, or they're looking for a 6 p.m. appointment. Sunday through Friday, we are able to provide those services. So again, the copays will be dependent upon your individual insurance, but we can look at your insurance for you and get a preliminary quote so that nobody has a huge surprise when it comes to seeking these services. One of the other things, some people have said, you know what, I really don't want to go through my insurance. I don't want to deal with the insurance companies and all the paperwork. So we've also created a more simplified telehealth helpline, whereby one of our licensed clinicians by the I think we were all muted, Ed. I just unmuted myself.
Good.
Okay, so the telehealth helpline is for somebody, maybe they just want short-term services. And again, they don't want to deal with insurance, or in some cases, people have a very high deductible or high copays because each insurance is different, and they opt to say, I just want to know exactly what I'm getting. And in this case, they're 30-minute sessions that are available much more, let's say, almost last minute. Somebody could call on a Monday and want service that week just to get started with something that they're going through. Maybe they just want to speak to somebody 1 or 2 times to sort of bounce ideas off of somebody with what they're struggling with a family or personal item. Those sessions are 30 minutes, as I said, but they are $36. So that's just clear cut as to when those services are available. And generally the clinician is offering them from 4 to 7 p.m. Tuesdays and Thursdays. However, I understand she has flexibility and will offer beyond those days if those days and times don't work. So I merely just want to make sure everybody knows that. One of the other programs that we offer is what we might consider for our special populations, veterans. I think some of you on this call are veterans, or perhaps you are a volunteer for our Take the Wheel program. Historically, this program is really for transportation to get our veterans to and from their medical appointments. Right now, we are not driving our veterans, but we do assist them with the financial costs of getting to their doctors if they're not able to otherwise get there. Historically, what this program is, and when I say historically, now I'm using before COVID, so really before March 16th or so, we were able to match volunteers, oftentimes a veteran, with another veteran driving him or her to medical appointments, including into Philadelphia or Fort Dix or to the VA in Gloucester County and Sewell. It's a free program. So if somebody's a veteran, they are able to partake in this program free of charge. We do have an intake. It's a fairly brief social work assessment, whereby the social worker makes sure we have an emergency contact on file. We know a little bit about you. In the case that we can't reach you, we would know who to call in the case of concern. We also want to make sure you're able to ambulate and transfer in and out of a car before we would say that we have a volunteer who can assist you. Again, right now, this program is still in part in existence, but we're now helping people individually more with the financial or logistical components of getting there outside of going with a volunteer, because we're not putting volunteers and clients in the same car during COVID. We do hope, of course, that that will change before long. Another population I merely want to mention, I don't know if any of you are Holocaust survivors or perhaps your family members are or were. If anybody knows Holocaust survivors who are in need, we do have many services and programs for Holocaust survivors who are living in our coverage area, which, like Aleph Home Care, is Camden County, Burlington County, and Gloucester County. In addition, we do service Cumberland County with specifics to the Holocaust survivor population. If somebody's a Holocaust survivor, they can qualify for home care assistance, both the financial and logistical assistance to cover that, as well as nursing supports, the catered meals that I mentioned, transportation services, attendance at our monthly social support groups, as well as financial assistance for home expenses in order to stay living in home and prevent institutionalization. I'm going to stop sharing my screen just while I talk to you just a few more minutes, because I know I'm just speaking more briefly. When it comes to our services, really, it's not a question of one size fits all. So most of our social workers, which are all master's level social workers, many are licensed, they offer what's called case management. And case management is really a catch-all term whereby we can assist individuals, short-term or long-term, with paying their bills, with navigating resources, almost as a surrogate child, spouse, friend, family member, on a weekly and every other week, a monthly basis, or on an as-needed basis. Many of our clients receive, let's say, added perks whereby they will receive holiday gifts, holiday meals, regular phone or in-person check-ins. We see our clients at a minimum 4 times a year, quarterly, in order to update plans of care. At this time, our services, we're seeing everybody through Zoom or FaceTime. Our social workers are not seeing them in person. However, we will go drop something off at their home or pick up their stack of mail and help them go through it, again, safely during the time of COVID. Just to mention briefly, we have many support groups. Our support groups really range in need, again, short-term and long-term, from bereavement, if God forbid or sadly somebody's lost a spouse or significant other. We have a bereavement support group run by one of our social workers to assist people in the more timely needs after the loss of a loved one, typically within the first year or so, but again, it might vary from person to person. We also offer caregiver support groups for those who are caring for a loved one with any kind of diagnosis, not specific to Alzheimer's or dementia, but many times there is a component of Alzheimer's or dementia. It may be Parkinson's, it may be cancer, it may be mere old age where there's no necessary diagnosis, but there's a lot of challenges that an adult child or spouse may be going through. We also have groups that are specific for the LGBT. Aging with Pride is the name of that group, where many people prior to about 2 years ago were not able to get those supports in South Jersey. They went into Philadelphia, but they were living in Cherry Hill or in South Jersey. So that group, actually, we have about 40 participants in our LGBT group for aging individuals. In addition, we have a memory cafe. Our memory cafe is very unique and special in that it receives funding through Camden County so that there's no charge to attend. It's once a month, and it is really social, whereby art and music activities, along with just a time to come together with your loved one. It could be your care partner. It could be your spouse, your friend, coming and you partake in this music or art program to have fun, again, once a month. Some other communities are offering them as well. So if somebody's looking for them more often, we connect them to other memory cafes. We also have a loss of vision support group. So with loss of vision, it's not specific to one diagnosis or another, but somebody might be going through glaucoma or macular degeneration, or merely just losing their sight. They don't necessarily know why or what's going on, and they're looking for adaptive resources. What can your iPhone do for you if you can't see it? Or Alexa in the house. How can you utilize Alexa if you're not able to see your calendar or small print to set alarms and reminders for things? We have a lot of speakers from the New Jersey Commission for the Blind and the like who can really help people with those needs as well. And then we have a patient advocacy program called Patient Partners, whereby trained advocates working under our registered nurse will accompany you to your medical appointments. At this point, it's virtual since COVID, but they are on the phone in this case. Prior, they were in person with you, and they can really help be an extension of you. You go over beforehand what's going on, and they'll help make sure that you remember to ask those questions that you wanted to ask. When you have that 15-minute window, it never fails. You forget to ask that one question that you've been waiting 3 months to ask, or 6 months. So it's really been a beneficial program to prevent medication trouble or challenges, to also help people stay out of the hospital, because oftentimes if you ask the questions and you're taking the right medication, you are therefore healthier and able to manage things better. Again, those services are available virtually at this point. Home care is something that we work very closely with Aleph Home Care. We're under the same license. So we're able to work with them to ensure that somebody gets their home health aide or their companion. I have a question in the chat if we've seen an increase in mental health services during COVID. The answer is absolutely yes, we have. We have many people who had been prior to COVID, maybe it could have been last year, it could have been 5 years ago, they were receiving counseling services, but things had maybe resolved or they thought they were at least stable or status quo. We've had many people call us since mid-March, some right at that time, others after a few months of living during COVID, whereby they are extremely isolated, they're fearful. As was mentioned, Ed had said very directly, he's willing to give up a year of his life if he knows that next year is going to be better. He's just going to live cautiously and be safe this year so that next year he can partake in everything he enjoys. Well, for many of our clients, they're 95 years old. So they say, I might not be here next year. This is the time that I can have to see my great-grandchildren or to meet my new great-grandchild or to go out and go to a store. If my joy is going to Boscov's or Macy's and I can no longer do that, what's the point? So we have certainly seen an uptick in counseling services in particular, as well as adult children or people living on the West Coast or in Florida. They're calling us because they're concerned about their parents. Since they're not seeing them, they're not really sure how they're functioning and what we can do to help them. So again, we try our best to meet their needs either through JFCS or through the community at large, connecting them with the resources that exist. I'm going to stop speaking at you and ask if there's any questions. I know some of the questions or needs may be personal, so what I would say is if there's something you want to ask, you can always email me or call me. And if your question is outside of my area of expertise, but perhaps one of my colleagues at JFCS can assist, I would gladly connect you. So I thank you for your time. Again, I know you've had a lot of being talked at today. So any questions or comments, I'd be happy to hear them.
So if you'd like to raise your hand or wave at me, I will recognize you if you have a question for Rebecca. For anyone who wants to contact any of our speakers today, if you haven't gotten the information off the chat, if you want to email me or you can even leave a message on our website, I will be glad to provide you their contact information. And obviously you can probably call the JCC, and if you can navigate their voicemail, you can probably get to them or get to somebody who can give you their contact information. But anyway, chat, Rob Sachs, no? Okay, I'm going to lower your hand. Don Weisenstein. You got to unmute yourself, please. You're all muted, so if you're going to speak, there you go.
I just wanted to thank you, all three of you, for a great presentation. Quite honestly, I was not aware of the services that you offer, and it's very enlightening to know that there's help out there, and I really do appreciate it.
Thank you.
Thanks, Don. Anyone else? David Nydorf?
Yeah, I wanted to tell a personal story of how happy I am with the Jewish Family Services. I'm a family physician, and I have a patient who's elderly and unable to get out of her home. She's a shut-in and has been looking for someone to go shopping for her and tried every agency out there. And when I brought up the idea of using Jewish Family Services, she's not Jewish, but she was very happy that Jewish Family Services came through for her and brought her a care package from the food pantry and brought her a shopper that is getting her food now. So it made a dramatic difference to her.
Thank
so that
you.
was good.
Wonderful to hear.
Thanks, David. Anyone else looking for either wave at me or put your chat hand up? I don't see anybody. If you want, if I'm missing you, you can unmute yourself and just jump in. But I do not see any further hands. Rebecca, thanks. Whoops, sorry.
Let me just share one more thing. So in the last 2 or 3 months, we've also created a job bank on our website, which I listed in the chat. We have listed community jobs that our outreach and marketing person are aware of, whereby agencies in the community have been able to tell us we have this job available. Perhaps some of them are through Jewish Federation, but many of them are not. we're looking to expand upon that. So if anybody is either looking for a job or knows of a job that's available, we would be happy to hear from you so that we can either help you get that job or to offer an extension to let people know in the community that your place of employment or friend has a job available. So please keep that in mind also.
Thank you. Thanks, Rebecca, for letting us know, all the services that you provide. Obviously, we all are kind of familiar with what you do, but it's nice to get it all, as a reminder once again. And thanks for all the help that you give people. I know people are very appreciative. I do volunteer with the food bank and with the Kosher Meals on Wheels program. And these people need your help, and they really appreciate, when the meals show up or the food shows up. And as Dave Neidorf said, you don't have to be Jewish. If you know somebody who's in need and they're not getting help, try JFCS. I'd like to go to a business meeting. I'd like to thank our speakers again. I don't know who's with us. I know, Rebecca, you're still with us. Thanks again
Sure.
For all your time.
My pleasure. So Ed, I'm going to sign off. I just want to make sure that it's not going to mess anything up because I know I'm still the co-host. So
No, I think you're fine. Thank you.
Okay. Sure.
All right.
Everybody take care and have a wonderful holiday. Take care.
Same to you.
So I wanted to go over a few things. I'm sure Don's going to want to say something about fantasy football. It's getting close to, well, it's not 1 o'clock yet, but everybody's looking forward to the Eagles and watching their ball players play and watching them get injured and be out for the season and so forth and so on. It's unbelievable how many people are getting injured every week. And now it seems that the COVID thing has kind of reared its head with one or two of the teams. But in any case, we'll enjoy it while we can. There's a few things I wanted to go over. The speaker that we had a couple of weeks ago who was with Stand With Us, and her name escapes me in my old age. Paula Jaffe, thank you. Has mentioned that they do an interactive tour of Jerusalem, and I think Marty, you had said you were on one of these tours. It's interactive. There's actually a guide who's going around, and you can ask him questions. Marty, I don't know. Am I correct? You've seen this? Can you unmute yourself and tell us just a little bit?
Okay, I was on a virtual tour, but it was not with that organization. Ours was related to Jewish National Fund, and it was for 5 days, approximately an hour and a half each day, and it was wonderful. They were in various areas of Israel. Some of the recordings were done the day before. Absolutely wonderful. And if we ever get an opportunity, we should probably pursue it.
Well,
but very, very good understanding of all parts of Israel, in areas even where typically people wouldn't go to. I learned a lot, for instance, about the southern part of Israel, which not too many people talk about.
Has anybody been on the Stand With Us tour? And I've seen the advertisement for it and viewed it. And it sounds like it's interactive, that you've got a guide who's moving around and you can ask questions about where he is and so forth and so on. There is a $10 charge. I imagine it's money that you're contributing to Stand With Us. They need 30 people, so I'm assuming the fact that they need 30 people that you're actually on tour with this guide and following him around, asking questions. He's replying to your questions and so forth. So I'll send something around to all the members. We can see if we can get 30 people together. I assume it's $10 a household that you can let your wife in on the tour too, or you can charge her $5, whatever. So that was one question I had. I wanted to let everyone know, I sent out an email, I'm sure you've seen it. Jay Sternchos has volunteered to sort of coordinate the Shiva, funerals, and so forth and so on. And so, I'd like you to make sure if someone passes away who you know is a member, to let him know, let me know, let a board member know that someone has passed away so that we can participate either, in a virtual funeral and a virtual Shiva. Obviously, hopefully one of these days they'll be live again, the Shivas and the funerals.
Oh,
But again, Jay is willing to coordinate it. Just let him know when this occurs so that he can make the membership aware and make sure with a widow or family member that they want to share this information with the club members. Obviously, we don't want to compromise anyone's confidentiality, but obviously the club members who knew the member would want to participate, I'm sure. I don't know if you can unmute yourself. If you have something, wave your hand, I'll recognize you. Don, do you want to take a minute and talk about fantasy football or?
Sure.
Go ahead.
Can you hear me again?
Yes, yes.
I just wanted to thank Bob and Rich. I know they're resting 3 of their better players today, guys. You don't have to stop there. 4 or 5 more is fine. But we are having a great time. We have almost, I think it's pretty close to 40 people involved with fantasy football, whether it be direct members or relatives of members. We have people have their sons, their grandsons involved with it. We have wives, we have sister-in-laws involved with it. It's turned out to be a really wonderful thing. We're hoping the NFL could continue to keep their season going. And most importantly, I hope that I can continue to win. But that's about it on the fantasy football thing. And just one reminder to Ed, I was looking through the bylaws, and believe it or not, we have nominations in February for officers already. So that's going to be here before we know it.
I'm looking for 12 years. If you're on this call, please let Marty Raffner know that you'd like to volunteer as the next president, vice president, board member. We're always looking for people. Anybody else? Wave your hand or just chime in at this point. No one? I don't see anybody waving at me. Anybody waving at me?
Dave Schwartz.
Dave Schwartz. Go ahead, David. Unmute.
Good morning, guys. Should be. Can you hear me?
Yes.
I just want to mention that Gary Sternberg wrote an article in the most recent Voice. And I think it's the first time in a long time that we've done that. And I want to commend Gary for a job well done. It was an article about the Israeli Technion meeting that we had last month. So thanks, Gary.
Thanks again, Gary. And as you know, we're doubling your salary.
Nice job.
Anyone else? Art Court.
Yeah, just wanted to mention that there's going to be an investment club meeting on Zoom immediately following this meeting.
Okay.
I notified all the members of the investment club. If there's someone out there who's not a member of the investment club and is interested in participating, send me a comment, send me an email.
Okay, anyone else? Hands up or wave at me. I'm looking for raised hands. No one? All right, everybody, thank you for coming this morning. I hoped you garnered some information you didn't know in the past about some of our organizations. And obviously, it sounds like from personal experience of some of our members that Aleph is doing a great job. Phil, thank you for your insight there. Thanks for your technical help too on screen sharing and so forth. You can teach me some stuff. Call me one of these days and teach me some other stuff.
I want to wish everybody an easy fast.
Easy fast, yes.
Same to you.
Easy
Yes.
too.
Same to
All
everybody.
right, guys. All right, a better New Year. A better day
Yeah,
is
for
coming.
sure.
It's just going to be a while, it seems. Thank
It's not
you.
going to be an easy fast when we got the kitchens right next to us. For some of us, we have willpower.
That's right.
That's long gone. Long gone.
Along with several
What's
other
that?
things.
Yeah, but you'll be
Uh,
quickly after the end of the chauffeur blowing. No commute.
Everybody.
So I have one more question. It was raised a couple days ago. Look at Mike Perloff. All right. So I have a question that came up, and I think I know the answer, but maybe somebody has a definitive answer. We're not building a sukkah at the JCC this year, are we?
It's a little late for that.
I would say it is. I haven't been contacted. Dave Wynn said he hasn't been contacted. I'm presuming with what's going on with COVID that there is no sukkah, although I saw one of the synagogues has like a mobile sukkah on a pickup truck. I forget which one it was.
Yeah, Beth Tikva.
Beth Tikva.
Okay. So I guess you'll have to build your own sukkah at home this year and enjoy that. Anyway.
Ed, I have to call the JCC and speak to Rob Kiwi, who's their director of operations now, about where to put the boxes for the Hanukkah cards for that
Right.
Operation Maccabee. So
Right.
if you'd like, I could also inquire at the same time about the sukkah if they intend to do anything.
Yeah, sure. I have
I
a
doubt
feeling.
it, but
Yeah.
Well, it's a little late now. You got to put it up as of Monday.
we're fast. We're fast.
The day after Yom Kippur.
Get your screwdriver out, Bob.
Tuesday. Yeah.
All right. Anybody else? And you want to schmooze for a few minutes? I'll leave it live if you want to schmooze.